recognize the gentleman from Georgia, the patient, Mr. Carter, for 5 minutes of questioning.
Thank you, Madam Chair. And Mr. Secretary, thank you for being here. Excuse me, Mr. Secretary, as you know, for the past 4 years, I have been the only pharmacist currently serving in Congress, and I currently remain the only pharmacist. Prescription drug pricing has been something that's extremely important to me and something that I've concentrated on. And I want to thank you for your work, and thank you and your staff in particular John O'Brien, who has done an outstanding job in helping us. And this is something you're familiar with. You're familiar having been a CEO of a pharmaceutical manufacturer, and that certainly gives you a unique insight. But I've dealt with it in over 30 years of practicing pharmacy and seeing the evolution of the middleman, of the pharmacy benefit managers, the PBMs, and the abuses that I feel like that they have had over the years. And now the administration is finally addressing that, and I can't tell you how much that means. And Mr. Secretary, I feel like this will be your legacy, and I think it's an honorable legacy, and I want to thank you for that. And this administration as well, as was mentioned, this administration has made this a top priority, and I think it will be one of their legacies. And there could not be a more honorable legacy, in my opinion, after having practiced pharmacy for over 30 years and seeing the impact that high prescription prices have on people. I've seen it at front counter. I've witnessed it. I've seen senior citizens have to make a decision between buying medicine and buying groceries. I've seen mothers in tears because they couldn't afford medications for their children. This is very serious and something that is bipartisan. Representative Schroeder mentioned earlier a bill that we're working on in a bipartisan fashion, the Blocking Act, that will be brought up next week. That's something that's very important. We have to do away with the abuse of the generic manufacturers to delay the system like this. Two things that have been proposed by HHS. One has to do with DIR fees. DIR fees are atrocious. 2 weeks ago, I got a text from a pharmacist who showed me where they had been charged, his pharmacies have been charged over $300,000 in DIR fees for the year. Only this morning, I got another text from a pharmacist who owns 7 drugstores, $500,000 in DIR fees. Mr. Secretary, you can't stay in business in that kind of business model. It's just not feasible. Moving the discounts to the point of sale. I've always said that the most immediate, most significant impact we can have on prescription drug pricing is to have transparency. This will help bring about transparency. Only this morning, United Healthcare announced that they are going to move this into the private sector as well. This is exactly what we need. This is exactly what we've been fighting for. That's why I want to thank you for this. I find it interesting that in the rebate rule that HHS and OIG, that they've asked for 3 different scores. That's a little bit unusual, isn't it? Can you explain what's come about with that?
Yep, absolutely. So the reason there are multiple scores in the proposed rule, and we wanted to be transparent about it, so we published them, is our actuary from CMS came out with a score, and you're trying to predict the behavior of private market actors. And I'm sorry, actuaries are well-meaning, but they don't predict how businesses and private actors will behaviorally change. You all see that with CBO and so-called lack of dynamic scoring around legislation. We have the same issue on regulations. And so we wanted to get these different perspectives of what might happen in the marketplace. I firmly believe that if we can work together to get this rebate rule out, we will bring $29 billion of savings to seniors at the point of sale at pharmacy starting January 1st. And I believe that we will keep premiums stable in Part D because it's a highly sensitive marketplace to premium. And I believe the Part D plans will manage that effectively. I think it will get list prices down. It's, I think, the best tool we can have to completely change how drugs are priced in this country for the benefit of our citizens.
I couldn't agree with you more, Mr. Secretary. I just thank you for that, and thank you for your efforts in this, and I hope you'll continue on with this. This is exactly the route we need to be taking, exactly the direction we need to be having. Moving very quickly to the 340B program. Look, we don't want to end the 340B program. It's a good program, but it needs some guardrails on it. We understand that. And That's what we're trying to do, is just tighten it up, get some accountability, some transparency, make sure it's going where it was supposed to be going. We're not saying that anybody is cheating. We're just saying that it's not being done in the way that we intended it to be done. Your comments on that?
We would love to be a partner with Congress and this committee on how we can bring that kind of transparency, oversight, and keep 340B effective for the purposes it was intended.
Thank you, Mr. Secretary. Again, I want to thank you for your work. Thank your staff for their work, the administration for this. This is about the patient. This will bring about lower costs for patients. It will bring about more accessibility, more affordability, and better health care in America. Thank you, Mr. Secretary.
Thank you.
Thanks, gentlemen.